Hi everyone, welcome back. Today we're going to discuss the osteology of mandible and we're going to discuss the temporomandibular joint, the TMJ joint. Starting off, so this is the mandible, anterior view and the posterior view. So mandible has body and then it has a ramus, a pair of rami and a body. This is body. Now body is more of a horseshoe shape and it provides area for, attachment of the teeth, whereas a pair of rami is present on the posterior surface of the body. Now, ramus, it gives attachment to the muscles of mastication. And muscles of mastication, they help in chewing. Now, there are a lot of important features that you should be able to identify on mandible. Starting off with the outer surface, first of all, you have symphysis menti. Menti is basically here, it divides the body into two equal halves, right? So it's better if you draw symphysis menti like this because this way you'll be able to see this triangle. Now this triangle denotes the mental protuberance. Mental protuberance is a median triangular projecting area in the lower part of the midline. So this is the midline. So this is the triangular projecting area and this is known as mental protuberance. And right beside the mental protuberance, you'll have mental tubercles right here. So we have covered protuberance, tubercle, and symphysis menti. Symphysis menti divides the mandible, the body of the mandible into equal halves. Then just below that, you have a median triangular projecting area, which is known as mental protuberance. Right beside it, you have mental tubercle, right? And this is the base of mandible, right? Base of mandible. See, and as I've already told you, this is the body, this is the ramus, and if you talk about the ramus, it is quadrilateral in shape. It has four borders, a posterior border, an interior border. So this is the interior border and this is the posterior border. Don't forget, superior border and an inferior border. The inferior border, it forms the angle of the mandible, whereas the superior border, it has a lot of important features that we will discuss, and it also has a mandibular notch. And then this is the posterior area and this is the anterior area. Before we move to ramus in detail, let's talk about the mental foramen, which is a very important feature. You'll see it right here, mental foramen. It lies below the interval between the premolar teeth. So these are the molars. This is the premolar teeth. So just below the premolar teeth, even right now you can touch your teeth and see the premolar teeth. Just below that you'll have a mental foramen. It's super important because this is the foramen through which the mental nerves and vessels pass through. Now, again, very important thing is the oblique line. Don't forget the oblique line and uh, subjacent to it, the mylohyoid line. Oblique line and mylohyoid line. Oblique line, you can see it right in front, right in the front, in the outer surface of the mandible. Mylohyoid line, you see in the inner surface of the mandible. So don't forget, oblique is on the outside and mylohyoid is on the inside. Oblique line is the continuation of the sharp interior border of the ramus. As I've already told you, this is the interior border of the ramus. So a continuation of this interior border of the ramus forms the oblique line. And then it runs downwards and forwards towards the mental tubercle. So you can see it going towards the mental tubercle. This is the mental tubercle. Now, incisive fossa. What is incisive fossa? It's a depression that lies just below the incisors. So all the incisors, the teeth, they have incisive fossa, right, into which your teeth goes basically. We are done with the outer surface. Now, when you come to the inner surface, you have the mylohyoid line, as I've already explained to you. It's a prominent ridge that runs obliquely downwards and forwards from below the third molar tooth. So, from below the third molar tooth, this is the third molar tooth, and to the median area below the genial tubercles. To the median area below the genial tubercles. It starts off from the third molar and goes downwards, mylohyoid line, to the genial tubercles. Where are the genial tubercles? Right here. These are also known as mental spines. They come in the group of four, right? So you have superior and inferior genial. You call them genial tubercles, or they're also known as mental spines. Now, exactly where are they located? In front, you have symphysis menti, right? So right behind the symphysis mental, exactly at the half of the mandible, you have mental spines. Now, very important thing about these four small elevations is that they give attachment to the genioglossus, which is the muscle of the tongue. Then moving on, you have yeah, very important thing about mylohyoid line. The other important thing is that above it you have sublingual fossa, and right below it you have submandibular fossa. See, submandibular fossa is right below the oblique line, and right above it you have the sublingual fossa, sublingual and submandibular. And then the other thing about it is that it has one more fossa, which is digastric fossa. This gives origin, not origin, attachment to the digastric muscle. This region here, digastric fossa. Now, this is very much near the midline, and it is basically an oval depression. Now, the upper or alveolar border, it bears the sockets for the teeth. This is the upper border or the alveolar border. So this bears the sockets for the teeth, right? And don't forget the incisive fossa that we discussed here. This is called alveolar part because see, this is alveolar part. This gives the sockets for teeth. So now your work is that you have to differentiate between incisive fossa, what exactly is that, and what is an alveolar socket. Uh, Differentiate between the two and let me know, and then we'll discuss this later in some other video. Now, the lower border of the mandible is called the base. So this is the lower border, it's called the base. The upper border is called the upper or alveolar border. Now, when you talk about ramus, right? As I've already told you, ramus has four borders. Now, the upper border of the ramus, it has very important features of projections, a condylar process and a coronoid process. And then it has a mandibular notch. Now, coronoid, what does coronoid means? It means crow's beak. Now, what does a crow's beak look like? It looks somewhat like this, right? And it points anteriorly. So this is an easy way for you to remember that the coronoid process, it is the anterior projection. The posterior projection is the condylar process. So anterosuperiorly is situated the coronoid process, which is the anterosuperior part of the ramus. And posterosuperiorly is the condylar process, which is the posterosuperior part of the ramus. And it expands from side to side. And other than that, expansion from side to side is called the head. Now, this head is very important because this will articulate with the temporal bone, the articular surface of the temporal bone, and two other features of the temporal bone and form the TMJ joint. Therefore, this needs to be covered in fibrocartilage, and it actually is covered in fibrocartilage. Now, other than that, there's a small constriction just below the head, that's the neck. And when you talk about the neck, let's not forget a very important feature called a pterygoid fovea. So the anterior surface of the neck, it's not very visible here, but I normally use Nature Atlas for my, studying sessions. So you can refer to that, open that book, and you will be able to see. Right now, I just got these pictures off Google, so I'm using them. Yeah, so here is the pterygoid fossa or fovea. It's on the anterior surface of the neck of the condylar process, right? So yeah, we've covered that. And then there you also have this very important thing called mandibular notch, right? So this is the superior part of the ramus. So it has coronoid process, mandibular notch, and condylar process. Now, very important things again. Now, the medial surface of the ramus, it has few important projections. One is the mandibular foramen. This is the mandibular foramen. So this is the medial surface of your ramus, and what you see from the outside is the lateral surface. So the medial surface, it has the mandibular foramen. Now this mandibular foramen, it's right in the center of the ramus, right in the center of the medial surface of the ramus, right, and at the level of occlusal surfaces of the teeth. So at the level of the teeth. and then this leads into a mandibular canal. That mandibular canal is not visible here, but it's there, and it helps descend into the body of the mandible, and it opens into the mental foramen. Mental foramen you can see in the posterior part. Then you have your after mandibular foramen, you have a mylohyoid groove here. Don't forget the mylohyoid groove. We had the mylohyoid line here. We had the oblique line outside, which was a continuation of the interior body of the ramus. Here we had the mylohyoid line, superiorly sublingual fossa, inferiorly submandibular fossa, and it points towards the genial tubercles, which give origin to the genial glossus muscle. And below you had an oval depression called digastric fossa, right? Here you had mandibular foramen right in the middle of the medial surface of the ramus, and then there's an mylohyoid groove. Mandibular foramen opens into the mandibular canal, and mandibular canal has its own significance that we'll talk about later. And this descends downwards, and it opens into the mental foramen. And here you have the mylohyoid groove. It begins just below the mandibular foramen and it runs downwards to and forwards to be gradually lost over the submandibular fossa. So this is submandibular fossa, so it gradually gets, erased or vanishes. Then you have a very important thing called lingua, which is a tongue-shaped projection. And where can you see it? It's in the interior surface of the mandibular foramen. So the interior margin of the mandibular foramen, it's marked by a sharp tongue-shaped projection that's called lingula. Lingula means tongue-like, right? So this tongue-like projection is directed upwards towards the, what do you think it is directed upwards towards? Towards the, see, condylar process. Correct. So that's pretty much it about the um, features, the bony features of mandible. Let's talk about the muscular attachments and the changes, and then we'll cover the TMJ joint in the next video. Now, when you talk about the muscular attachments, first of all, actually, you know what? I think I'll record a second video, part two, for the muscular attachments. So pretty much that's it.